Welcome back. COVID-19 has forced all of us to adjust how we manage our daily lives. Now, most of us are fortunate enough to have a place to call home and a safe place to isolate if need be. But what about those individuals that don't have a place to call home? I spoke with Carol Pierce, Director of Family and Community Services, to share with us all that the city and the partners that they are working with are doing now for those experiencing homelessness. This morning we are joined by Carol Pierce. She is the Director of Family and Community Services with the City of Albuquerque. Carol, always great to have you with us.
Thank you so much for having me.
Definitely. Right now, let's see, we want you to highlight some of the work that's been done right now to keep folks safe in the community here, and especially the homeless population.
Well, the City of Albuquerque, along with our partners, we are currently operating 4 hotels in our community, in addition to our West Side Emergency Housing Center. These 4 hotels, 2 of them are for people who are COVID positive, who need to be isolated, and they're receiving all the support that they need to get well. And then 2 of those hotels we call wellness hotels. And those are people who are older, who have chronic health conditions and are a little bit more at risk for COVID. I think the really important thing about these wellness hotels is keeping the density out at the west side lower so we can keep that population as healthy as possible. But also, this is the pathway to housing. The ultimate solution for people without homes is to provide them a good fit for the housing that meets their needs. And that's what the next step after these wellness hotels is housing.
Is there a list of where these hotels are located out throughout the Duke City?
You know, there is, but we don't publicly talk about it because we just really want to keep those folks safe and keep them their privacy respected.
Yeah, and that's a good way to do it. And right now, for anybody that says that they need access to one of those hotels and facilities, how can they reach out to the city to make that happen?
Well, the entry point is to go through our West Side Emergency Housing Center. Okay. Because that's where we've got anywhere from 250 plus people, all COVID safe, all separated. But really, then the assessment process begins if there are older folks that need to access to this hotel.
What's the latest right now with the gateway centers?
Yeah, I'm glad you asked. The Homeless Coordinating Council, chaired by the mayor, has been faithfully meeting every 2 weeks since August. 5 committees also are doing work to identify high-impact strategies, which includes gateway centers, smaller places for emergency shelters surrounded by services. And so that work is alive and well, and I think we'll see more about this here in the next couple months.
Well, and again, there's a survey where many can still take part in giving their input on this. How can they do that? Yes,
thank you. cabq.gov/homeless. There's a link to the survey. And what the survey is it talks about the framework that's coming out of the Homeless Coordinating Council with high impact strategies to really help those people without addresses. And we would love to have the public weigh in, give us your thoughts, and we'll look forward to that.
There you go. Is there a deadline on that, Carol?
You know, we were going to keep this open about a month, but just similarly when we did this a year ago to get some input, which we had over 1,000 people weigh in, which was great, helped us get to where we are today. I would love to have a couple thousand people weigh in. So we've got a couple hundred at the moment. So if we don't get the feedback, we'll just keep pushing and reminding people, because I know we're up against the holiday season, even though holidays will be a little different this year.
There you go. Carol, once more, the web address where we can find more information.
cabq.gov/homeless.
All right. Carol Pierce, thank you again for joining us this morning. We appreciate it.
Thank you for spreading this information.